Well, more than 100 million Americans have bunions, making it one of the most common foot problems in the U.S. And many people think they may have to just live with the pain. That is definitely not the case, though. In this segment, sponsored by Orthopedic Foot and Ankle Center, I'm happy to chat with Dr. Randall Thomas about this newer and less invasive, which is the word a lot of people like to hear, treatment option. So, doctor, thanks for being here.
Thanks for having me.
All right, so I did not realize at first, that as I'm looking into this, that bunions are so common. So for some people, though, who aren't aware, tell us what they are. Why is it that they cause so many problems?
Yeah, so bunions are very common. About a third of Americans have bunions, or at some point in their life will have bunions. There's about 330,000 bunion surgeries done a year. It's a malalignment of the big toe joint. Okay. People think it's a bump that sticks out. It leads to your big toe going towards your second toe, and a bump coming out to the inside of your foot. Can cause a lot of pain. The joint's not aligned anymore, difficulty fitting into shoes, pain and arthritis can develop from it.
And there are advancements in this surgery, like many others, right? Things have come a long way. So tell us about the newer kind of techniques. Yeah,
the newer techniques, there's kind of two categories of that. One is what we call a Lapidus modified procedure by Dr. Lapidus since 1934. Then there's this other new wave of minimal invasive bunion surgeries. We're in about 30 years of doing minimal invasive surgeries, but the most recent generations are much better. So about 5 years ago it changed. And this involves doing very small keyhole incisions on the side of the foot with just a couple of stitches, has less recovery time, less pain involved, and still achieves the same, if not better, outcomes.
And you, in fact, pursued advanced training in this, right? Was that something that you took upon yourself and said, this is helping people and the recovery is better, the outcomes, right?
Yeah, well, so I decided to train on this for about 7 years before I did it in a live patient. 2018, I did my first one. We were talking a lot with healthcare providers about it, trying to build this up to be able to achieve good results with patients. First series with healthcare workers, nurses, and doctors having their bunions done by me, and now it's become more common. The traditional bunion surgeries are very barbaric and antiquated, painful, general anesthesia, off your foot for 6 or 8 weeks, cast, crutches, wheelchairs. And these minimal invasive techniques allow you to walk the same day of surgery, less anesthesia, less pain, actually have less recurrence. So I took it upon myself to train kind of throughout the United States on it, did a bunch of labs and years of training until we started doing them. Now we're doing about 220, 250 of them a year.
Wow.
Myself, and it's become very common.
Become very common. Okay, so I want to pop up a picture, and this is an x-ray of a foot that obviously had a bunion, and I want you to talk about that recovery, that outcome. Is it the same when you're going through that minimal invasive surgery versus the standard?
So that's the beauty of this technique, is these are small incisions, not a big open incision. We're not opening up the joint. You don't get as much scar tissue. You end up having good range of motion, and you still get better alignment and functionality of the joint. So it's a quicker recovery, less painful, and we found the recurrence rates in these are about 2 to 8% anecdotally. We've looked at that data. Traditional ones are around 25 to 40% recurrent. So it's actually led to better outcomes overall.
Better outcomes. And the before and after photo we're about to see, I mean, it is night and day. So somebody's probably going to be wondering, like, is everyone a candidate for this? Am I able to get this procedure?
Yeah, great question. So the MIS, or minimal invasive surgery for bunions, there's some criteria that we look at on x-rays and on clinical exam that determine whether you're a candidate or not. I would say more folks are candidates than I initially thought. I always stick to the very strict kind of algorithms of who qualifies because we want good outcomes. But usually they're qualifying for the minimal invasive technique or the modified Lapidus type of technique.
Okay, all right, then let's look at this animation. This is going to show you a bit about how this surgery works. And as you take us through the steps, tell us about kind of the outcomes and I guess the time of recovery if somebody's going through this surgery.
Yeah, so this video right now is looking at these small keyhole incisions, and then we use a burr to make the cuts, and we take the head of the bone and slide it over into position. Then we're going to lock it with screws that hold this in position. The screws are made for the bone, so they sit flush. They aren't prominent or stick out or anything like that. And then we're going to take off some of the extra bone, and we're going to realign the toe itself to where it sits in a better position. One of the advantages of this is we can do this without general anesthesia. You can do it under twilight. I've actually had a lot of patients do it under local where they're awake for the surgery, and we just numb up the foot itself to fix this. Also, you're walking right away, and less scars, but less pain with the recovery. These burrs were finally approved by the FDA for us. They've been in Europe and Australia for 50,000 cases they've presented, and this allows us to do this in a much easier fashion for folks.
Yeah, certainly. Okay, well, I want to let people know orthofootankle.com, the website. You can also give a call and meet with someone from the team, because if this is available, a lot of people are going to want to know that, able to have a faster surgery with better outcomes.
Well, thanks for letting us get out in the community.
Yeah, absolutely.